Today's presentation is titled Open House Celebration, 20 Years in BPSO, Niagara Health. It is with great pleasure that I introduce you to our speakers today. Natalie Ferrero is the Interim Director of Nursing Practice at Niagara Health. In her role, she sets the vision and leads the design, implementation, and evaluation of structures and processes to advance nursing practice and education. In addition, she provides oversight and direction to integrating professional regulation standards into organizational practice. Natalie sets evidence-informed clinical practice standards and maintains clinical policies and procedures to enable the best patient outcomes. Natalie has worked in various management roles since 2015, which includes general pediatrics, pediatric complex care, neonatal intensive care, hemodialysis, and adult and pediatric ambulatory care clinics. Natalie has over 20 years of experience as a registered nurse at Niagara Health and McMaster's Children's Hospital, with an expertise in emergency medicine, general pediatrics, and pediatric intensive care. Throughout the COVID-19 pandemic, Natalie aided in leading the hospital's COVID-19 response, including the COVID-19 assessment centers, mass vaccination clinics, and the vaccination immunization task force. Natalie has a Master's of Healthcare Leadership from Royal Woods University. She has been recognized for her work by receiving the Nursing Excellence Award in 2019 and the Interprofessional Leadership Award in 2021 from Niagara Health. She holds 6 certificates, one which includes a 6 Sigma Black belt. Natalie currently sits on many committees at Niagara Health and within the Niagara region. Natalie has volunteered her time for various nursing leadership positions for organized athletic events, including the Ontario Special Olympics, and was Chief Nursing Officer at the 2022 Canada Summer Games. Apologize. Tanya Grovenvelt is the Manager of Professional at Niagara Health. She leverages her expertise in critical thinking, problem solving, and conflict management to drive continuous quality improvement. Tanya excels in prioritizing managing multiple projects while fostering teamwork and relationship building. Stephanie Ralph is a registered nurse in the Geriatric Assessment Program, as well as a part-time faculty member with the School of Nursing and PSW at Niagara College. Stephanie is the co-chair of the Best Practice Spotlight organization for Niagara Health and has been a committed member to other committees, such as the Nursing Advisory. Stephanie has a keen eye for best practice implementation and uses the knowledge of action framework to aid in best practice implementation across the organization. Stephanie has completed an RNAO Advanced Clinical Practice Fellowship in Care for the Older Person Strategies and has developed interprofessional tools to help create and establish robust care plans for patients admitted to the hospital. Stephanie loves to teach, mentor, and engage in ongoing quality improvement in every area of her work. Stephanie is a team player and has been recognized for her work by receiving the Nursing Award of Excellence in 2023 for ongoing patient care. And she
stage 2, 3A nephrology, code yellow, stage 2, 3A nephrology, code yellow, stage 2, 3A nephrology.
And she is now being recognized and nominated for the Nursing Award of Excellence for 2024. Wow, it is a pleasure to have all of our presenters with us today. And I'm now going to pass this over to them. Thank you, ladies.
Thank you so much. So welcome to our presentation on Niagara Health's 20th anniversary celebration as a best practice spotlight organization. I'm thrilled to be joined here with my colleagues, Tanya and Stephanie, as we share our insights for this event, highlighting our organization's exceptional work across 5 hospital sites. Our inclusive 4-day roadshow engaged over 500 participants, including BPSO committee members, champion network leads, and the Niagara Health leadership team. Through dynamic discussions and online engagement, we showcased our champion network and received overwhelming positive feedback, reinforcing our commitment to drive transformational change and excellence in healthcare delivery. I'm just going to take a minute for everybody to just read through our land acknowledgement, as we already shared a land acknowledgement from the RNAO.
So Niagara Health is a large 5-site organization spanning a large geographical area. Our organization is composed of acute care, complex continuing care, rehabilitation beds, mental health, pediatrics, as well as various outpatient and ambulatory care areas. Here at Niagara Health, we service varying age demographics and understand the complexity of individuals throughout their lifespan. Our BPSO committee hosts bi-monthly meetings along with the Nursing Advisory Committee here at Niagara Health. We are composed of 3 co-chairs to ensure continuity and reduce the risk of cancellation. We have currently implemented over 10 BPGs into clinical practice over the last 20 years, with ongoing commitment to ensuring policies, procedures, and other organizational initiatives meet best practice guidelines and support current evidence-based practice. Since 2016, we have supported 3 full advanced care practice fellowships, with 2 applications submitted to this current cycle. We have also had members of our Best Practice Spotlight Organization Committee selected to be reviewers for the Advanced Clinical Practice Fellowships. Last year, Niagara Health supported multiple abstract submissions for their symposium, with 2 accepted submissions for which 3 members were given the opportunity to present on the work that they had been doing in areas of falls as well as champions. With continuous sharing of RNAO webinars and knowledge exchange, we attempt to engage in as many learning and sharing opportunities as possible. We do complete the BPSO designation report annually with our newest best practice guidelines, which are being implemented in relation to digital health strategies, as well as diversity and inclusion, for which we are partnering with Niagara Health's DEI team. Niagara Health is one of the original BPSO designates, receiving our designation 20 years ago. With the $1,000 from the RNAO, we were able to host a roadshow across our 5 hospital sites. During this time, team members of our BPSO committee and members of various champions networks attended 2-hour blocks at each site to share information about champions networks and to share the work that's being completed within those champions networks. They were also able to share experiences on how they were being engaged in activities and how they are showing dedication to improving clinical practice. We also worked to recruit more like-minded individuals and motivated individuals. We had an interactive wheel with questions from the display boards to engage in further conversation with interprofessionals, students, families, and other guests. We offered a variety of giveaways, including custom stickers, pens from both RNAO and Niagara Health, RNAO lanyards, different pins and buttons, as well as reusable bags and candy. We did feature a grand prize supported by our professional practice colleagues here at Niagara Health, and we were able to support 1 RNAO membership to any interprofessional member who participated in the event. This award was given to our senior OT at our Welland site. During the event, we also promoted various RNAO initiatives like the Advanced Clinical Practice Fellowship, as well as upcoming workshops hosted by the RNAO to help continue building capacity for both our BPSO committee and RNAO commitment for all professionals within the organization. As a BPSO, it is important to build and sustain champions networks in all areas of practice. As an organization, various methods of building and sustaining have been trialed over these last 20 years. In 2022, Niagara Health has dedicated focus on putting people first and working on ways to engage people in meaningful work. Niagara Health has currently sustained 4 champions networks in areas of falls, palliative care, care for the older person, and wound care, for which we'll talk about in the upcoming slides. Champions are highly encouraged to participate in the RNAO Champions Workshop, and together with the organization, we are looking at ways to support funded opportunities for people to engage in such workshops. Pre-COVID, Niagara Health had actually hosted in-person workshops to help build and sustain champions networks. This image here highlights the way in which we displayed all of our champions networks. So team members from the networks were able to build capacity with employees and other family members and guests and aim at further recruitment to the specialized area. This photo is a setup of what traveled to all 5 sites. Each champions network was able to create a poster to highlight the work in which they were doing, as well as to connect to the BPGs in which they are working to sustain and implement. Roadshow participants were also provided with matching t-shirts for assisting in that roadshow opportunity.
We are excited to share that our Falls Prevention Manager is a forthcoming RNAO expert panel who will be reviewing and rewriting the new Falls guideline. Our Falls Committee is dedicated to preventing falls through a range of proactive measures and collaborative efforts based on the BPG, preventing falls and reducing injury from falls. We start by implementing falls prevention strategy at the earliest stages. For example, when a patient comes to our hospital for a test or procedure, we identify if they are a falls risk. And if they are, then a yellow band is provided for them to ensure all team members are aware that this patient is at risk for falls. This helps ensure the safety and well-being of our patients. The committee actively participates in our frontline teams to support the development of innovative projects such as We Move, which also aims to reduce falls risk. We Move is an interprofessional initiative which includes a standardized approach to mobility assessment, and it ensures that patients' individualized mobility level is included in their care plan. Additionally, we engage both the Falls Steering Committee and the BPSO Committee to ensure that best practice guidelines are thoroughly integrated into all project developments. These initiatives highlights our commitment to maintaining a safe environment and improving patient outcomes through effective falls prevention. Our palliative care team is a true champion of compassionate care and began their work in the fall of 2020 with a rollout to nursing in the spring of 2021. Champions are required to complete the Pallium LEAP course as part of their commitment, and we have also included other disciplinary teams such as occupational therapy, physical therapy, and discharge planners. The palliative care champions are a group of highly motivated and passionate individuals dedicated to providing high-quality palliative care to our patients and families. The team has implemented the RNAO best practice guideline, a palliative approach to care in the last 12 months of life, and hope to implement end-of-life care during the last days to hours in the near future. The BPGs play a pivotal role in promoting standardized care within the realm of wound, ostomy, and continence. The guiding principle of the Super Wound Care Champions Network is safe, evidence-based patient care. Since April of 2023, we implemented the Advanced Wound Care Days, and to date, we have held 19 sessions across the 5 sites, providing over 300 RPNs and RNs with best practice wound care education. In July of 2023, a huddle blitz took place across all 5 sites, providing staff with BPG education on wound irrigation and obtaining wound cultures using the BPGs. By the end of February 2024, 2 staff members per unit have been trained to become super wound care champions. We are also fortunate to have removed all our foam surfaces across our medical, surgical, and complex care units and replaced them with gel surfaces that help prevent all stages of pressure injury by redistributing the pressure areas and absorbing the patient's weight. Natalie has been chosen as an external reviewer for the 4th edition of the Risk Assessment, Prevention, and Treatment of Pressure Injuries, BPG. Our Care for the Elder Persons team have developed an interprofessional champions network aimed at improving care for our older persons and aligning practice with current strategic initiatives. With funding from the Ontario Nurses Association, 10 ONA members have completed additional education to prepare for their roles as champions, ensuring alignment with best practice. The team has also had 2 RNAO Advanced Clinical Practice Fellowship, both of which focus on the assessment and care of delirium, dementia, and depression in the older adults. We currently have 8 care of the older adult champions across our 5 sites. Additionally, recent APCF initiatives have been aligned with the care of older persons and further enhancing our commitment to providing high quality care for this population. Throughout the event, communication support ensured posts to all social media platforms. RNAO hashtags and Niagara Health hashtags helped promote engagement and even caught the eye of Doris Grimson when our tweet was acknowledged and retweeted. RNAO provided pamphlets, pens, and lanyards to support our event, and stickers, candies, and other swag items were purchased to help draw in attention and engage interprofessional staff. The event highlighted upcoming opportunities for the APCF, upcoming RNAO webinars and education, and becoming RNAO members. We were able to recruit new members to the BPSO committee, and different champion networks were able to recruit more members.
In closing, I want to extend my heartfelt gratitude to each of you for joining us today. Our journey as a best practice spotlight organization at Niagara Health has been marked by dedication, collaboration, and relentless pursuit of excellence in healthcare delivery. As we reflect on the insights shared today and the remarkable work showcased during our 20th anniversary celebration, let us reaffirm our commitment to driving transformational change and upholding the highest standard of care for our patients and community. I encourage each of you to continue to champion best practices, foster innovation, and embark continuous improvement in your respective roles. Together, we have the power to shape the future of healthcare and make a lasting impact on the lives of those we serve. Thank you once again for your participation, engagement, and unwavering dedication to our shared mission. Let's continue to inspire and elevate each other as we journey forward.
It's wonderful. Thank you so much, Natalie, Tanya, and Stephanie, for sharing your experience, your engagement, and your dedication as a BPSO site for over 20 years. It's just amazing. Such a wonderful presentation with such enriching knowledge to pass on to others. Thank you. At this time, we would like to